Hello viewers, let's talk about formulation. As we have already discussed in our previous lectures about the parenterals formulation products. Aqueous vehicle, water for injection, USP. Highly purified water used as a vehicle for injectio preparations which will be subsequently sterilized. According to the United States Pharmacopoeia, USP requirement include not more than 10 parts per million of the total solids. The pH for water for injections is 5 to 7.0. For water for injection may be prepared by either distillations or reverse osmosis to stored and chemically resistant tank. Furthermore, bacteriostatic water for injection. It can be explained in the term of this type of water used for making parenteral solution prepared under aseptic condition and not terminally sterilized. Bacteriostatic water for injections. There is need to meet USP sterility test. It can contain an added bacteriostatic agent when in containers of 30 ml or less. Sterile water for injections containing one or more suitable bacteriostatic agent. Multiple dose containers not exceeding 30 ml. So they are formatted to contain higher level of solid than water for injection because of possible leaching. Used for sterile water for injection, it is used for washing wounds, surgical incisions or body tissues. Water miscible vehicles. The number of solvents that are miscible with water has been used as a portion of vehicle. So primarily to affect the solubility of drugs and to reduce the hydrolysis. Excellent examples of water miscible vehicle, that is ethyl alcohol, liquid propylene glycols or glycerine and ethyl alcohol, which is used in case of cardiac glycosides. In non-aqueous vehicles, the fixed oils are used like vegetable origins, liquid and rancid resistance unsaturated free fatty acid content. Other examples are peanut oil, corn oil, cottonseed oil, testosterone, sesame oil, soybean oil, ethyl oleate and isopropyl myristate. So all these are non-aqueous vehicles. Other additives are antibacterial agents. Other antibacterial agents, these are added in multiple dose container to prevent the microorganism growth. Limited concentration of agents are used. Penyl, mercuric nitrate and thiomersol 0.01%. Benzethonium chloride and benzalkonium chlorides is in 0.01%. Phenol and cresols and 0.05%, while chlorobutanol and 0.05%. So these are used as antibacterial agents. Now buffers are usually added to maintain the pH, power up hydrogen ion concentration, to stabilize a solution from chemical degradations. Citrate and acetate buffers, they are used sodium benzoate and benzoic acid, sodium tartrate and tartaric acid, so they are also used, as well as the phosphate buffer can be used. Antioxidants are those agents which can protect the formulation from the oxidations. There are two types of oxidation. So the first one is reducing agents, which are ascorbic acid, vitamin C, sodium bisulfite 0.01%, and thiourea. So these are used as an antioxidant agent. In order to protect or avoid the formulation from oxidation, while the second one is blocking agent. So the blocking agent is tocopherols, vitamin E. Come towards surfactants. Surfactants, in simple words, it can be defined as surfactants are the solubilize the active ingredients. Surfactants are surface active agents like polyoxyethylene, sorbitol, monoaleate, and sorbitol monoaleates, or tonicity agent. Tonicity agents need isotonic solution to avoid the destruction of red blood cells, irritation, and tissue damage. More important for large volumes, rapidly administers and extravascular injections. It reduces the pain or injections, for example, sodium chloride and potassium chloride, dextrose, mannitol, and sorbitols. So you can see here, these are the different conditions. This is the effect of different solution on the blood cells. So you can see here the condition of the red blood cell. Here in this condition, this is normals, while in case of hypertonics and hypotonics, the conditions are different. Here hemolysis occurs, so the RBC, the red blood cells, it become broken down. Chelating agents are those agents which are used to remove the trace elements that catalyze the oxidative degradations. For examples, ethylenes, diamine, tetraacetic acid. That is also called EDTA, ethylene, diamine, tetraacetic acids. Co-solvents are also used in order to improve the solubility, and it can prevent the potentials for hydrolysis. Bulking agents are the agents which are used for freezings or to freeze dried preparations, solids. For examples, bulking agents, that is mannitol, lactose, sucrose, and dextrans. And suspending agents, the CMCs use carboxymethyl cellulose or methyl cellulose, gelatins, and sorbitols. They are used in suspending agents, while in emulsifying agents, lecithins and polysorbate AT is used. Water for injection, it is a clear and colorless liquid or odorless. Water for injection is ferrogen free. It contains no added substances. Water for injections is obtained from potable or purified water by distillation in an apparatus. The distillate is collected and stored in conditions designed to prevent the growth of microorganisms and to avoid any other contamination. Manufacturing of water for injection, the source water usually must be pre-treated by one or a combination of the following treatments like chemical softenings, filtration, deionization, carbon absorption, or reverse osmosis purifications. There are three types of distillation still to produce water for injection. The first one is compression distillation, while the second one is multiple effect still, and the third one is reverse osmosis. In compression distillations, the vapor compression still is primarily designed for the production of large volume of high purity distillate with low consumption of energy and waters. Vapor compression process produce water 5 to 10 times more cost effectively than multiple effect distillators. Now come toward the basic procedures for the compression distillation. So first of all, in first step, we will do in a vapor compressions still the boiling process begins with both heating elements turned on as the water in the boiling chamber reaches near boiling temperature, so the compressor turns on. And second step, especially in the compressor, the steam is pressurized, which rises the steam's temperature before it is routed through special heat exchangers located inside the boiling chamber. While in step 3, the pressurized steam gives off its heat to the tap water inside the boiling chamber and causing this water to boil, which creates more steam. In step 4, while the pressurized steam is giving off its latent heat, the steam will condense and one of the heating elements will cycle on and off periodically as needed. While in step 5, at this stage, the condensed steam is considered distilled water but is still very hot, so only slightly cooler than boiling temperature. This is the flow sheet. This is the actual sketch of compression still. And multiple effect stills it is also designed to conserve energy and water usage. In principle, a series of single effect stills running at different pressures. A series up to 7 effects may be used, with the first effect operated at the highest pressure and the last effect at atmospheric pressure. The capacity of still can be increased by adding effects. The quantity of distillate will also be affected by the inlet steam pressure. Now the procedure for it, steam from the external source is used in the first effect to generate steam under pressure from feed water, so it is used as a power source for second effect. The steam used to drive the second effect condenses as it gives off its heat of vaporization and forms a distillate. The process continues until the last effect, when the steam is at atmospheric pressure and must be condensed in a heat exchanger. look at here the multi-effect distillation. This is the first pressure which can be represented by P1, while this is the second effect pressure P2, and this is the third one. And you can see, so these are the vacuums, and this is what the steam, as you can see here, it can go inside and then it become condense. So this is the flue sheet diagrams. While in second effect pressure V2, the same condition is here. Here is this is a fresh water product. This is brine discharge, while this is vacuum form. Reverse osmosis is the natural process of selective formations of molecule through a semi-permeable membrane separate to aqueous solution of different concentration is reversed. Pressure usually between 200 to 400 psi is applied to overcome osmotic pressure and force pure water to penetrate through the membrane. Membrane composed of cellulose, ester or polyamides. It provides effective rejection of contaminants molecules in raw water. Sodium chloride is most difficult to remove. Passage through two membranes in serial is sometimes used to increase the efficiency of removal of small molecules. For examples, aqua, chems in pen, aqua in Miko and Medifor, etc. And reverse osmosis occur when a pressure higher than the osmotic pressure is applied to a solution to filter out the solute molecule. You can see here, this is what, so these are the solvents and this is semi-permeable membranes, while the solute and solvent, so when they are combined with it form solution, and this is a semi-permeable membrane. As we know that semi-permeable membrane can pass only, so some of the molecule can pass from this membrane while some of them left behind it. Storage and distribution. So distillate is collected in holding tanks for subsequent use. USP permits the storage of water for injection at room temperature, so maximum for only about 24 hours. When the water cannot used at 80 degrees centigrade, so heat exchanger must be installed to reduce the temperature at the point of use. In large volume parentals, the requirements are sterile, non-pyrogenics, free from particulate matters. The volume is up to 101 to 1000 ml. So the single dose unit, while in this case there is no preservative is used and clear solution except fat emulsion. It must be isotonic, but hypertonic also administered in TPN, total parental nutrition. Types of large volume parentals: hyperalimentation solutions, while the second one is cardiophagic solutions, and the third one is peritoneal dialysis solution, and the fourth one is irrigating solutions. Hyperalimentation solutions and this type of solution, the administration of large amount of nutrients to the patient who is unable to take food orally. Formulations, mixture of dextrose, amino acid, lipid electrolytes and vitamins. And total parental nutrition, it is a method of feeding patients by infusing a mixture of all necessary nutrients into the circulatory system, thus bypassing the gastrointestinal tracts. The contents are calories, nitrogens, electrolytes, vitamins, and elements. Calories are dextrose, nitrogen, that is crystalline amino acids. Electrolytes, they are sodium, potassium, chlorides, and phosphate. Vitamins are water soluble and fat soluble. The elements are traces of zinc, copper, manganese, and chromiums. Cardiopelagic solutions. So in this type of solutions, or you can say LVP is used and heart surgery to prevent the injury to the myocardium during reperfusions, as well as to maintain the bloodless operating field. The large parental volume, it maintains the diastolic arrest, administers in cold form, slightly alkalines to compensate metabolic acidosis, as well as hypertonics. Their uses are to minimize the reperfusion injury resulting from the tissue edema. Peritoneal dialysis solution, it is infused continuously into the abdominal cavity, bathing peritoneum, and are then continuously withdrawn. The uses are there is removal of toxic substances from body, to add and accelerate excretion normal, to treat the acute renal insufficiency. The fourth one is irrigating solutions, to irrigate, flush, and aid in cleaning body activities and wounds. Certain IV solutions, normal saline, may be used as irrigating solution, but solution design is irrigating solution shouldn't be used parenterally. So the uses treatment of serious wounds infused into the bloodstream. So these are the common example of low volume parentals. The first one is dextrose injection. So the common name is glucose, concentration 5 to 25%. Therapeutic use, fluid in calorie supplement. Sodium chloride injection in acid is normal saline solution, that is 0.9 to 3.5 concentration. Therapeutic use is fluid in electrolyte supplements. Ringer lactate or Ringer solution is Ringer solution, so NaCd 0.8, potassium chloride 0.03, calcium chloride 0.033. Therapeutic uses fluid and electrolyte supplement, lactate, Ringer injection, that is hard means, so NaCd 0.6, potassium chloride 0.03, and calcium chloride is 0.02, sodium lactate 0.3. So its therapeutic uses systemic alkalizers, fluid and electrolytes replenishers. Fifth one is mannitol injection. So mannitol injection is in the concentration of 5, 10, 15, 20. So it is actually act as osmotic diuretics. While an IV fat emulsion, so that is available in a concentration 10, 15, 20. So therapeutic use is caloric. Small volume parentals or small volume intravenous injection is applied to an injection that is packed in container label is containing 100 ml or less. Types of small volume parentals, that is solution, suspension, emulsion, and dry powders. These are small volume parentals. Inshallah, in my next lecture, we will talk about the solutions generally, suspension, advantages of parental suspensions, injectable emulsions, dry powders. So I'm very thankful to all of my viewers for watching my lectures on routine based. So wish you all the best. Thank you so much for watching my lectures. Once again, wish you all the best.